Over the period of several years, I always had my annual check, which included a PSA, a blood test for the protein-specific antigens, which is the routine count on whether or not you might have a prostate issue. For many years, I was about 2.0, and then all of a sudden, in the summer of 2011, I was over 4. And so my primary physician said, well, that's a spike. Let's check it in 30 days. And so I came back, and it had elevated even more. So I went to a urologist, and over time, it eventually led to getting a biopsy, in which case it was discovered that I had prostate cancer. Well, I was at work actually on a Friday afternoon, and my doctor called me and said that he was, in one breath, said, "We have found you have prostate cancer, but there are a lot of great options." I think at the time there were about 5 major options, and brought my wife into the urologist's office with me. We studied the options and made a choice together that I chose a very specific radiation technique. I had 9 weeks of radiation 5 days a week. It took about 5 minutes a day. Along about mid-course, about the 4th or 5th week, I started getting some fatigue and some what we call urgency problems, like feeling like you have to urinate very urgently but not being able to. But that was relieved through medication. So there was a medication mid-treatment that could relieve those symptoms. So other than that, towards the end, a little bit of fatigue, but throughout the course of my treatment and the course of my cancer, I really never had a single symptom of having cancer. We always talk to men about to know your numbers and know your options, whether it's cholesterol, hypertension, and in this case the PSA count on your prostate exam. Most cancers are very treatable and have no interference with the quality of life as long as they're caught in a timely manner, and then you make decisions along with your spouse, your partner, and your physician about what you want to do about it. As you can tell, Movember, I've embraced the movement quite aggressively here. But we want to raise awareness about prostate cancer for men. That if you're 45 or over, it would be advisable to get a routine check. A blood test and a digital rectal exam will usually indicate any trends. It's good to know your baseline numbers. In my case, for years, I knew my baseline number, my PSA count for numbers, so we knew when there was a trend upwards. And know that just because you might get a high count does not necessarily mean you have cancer. For me, once I first had my high PSA, it was a period of 6 months, actually, before I got a biopsy and then made a decision for treatment. So it's not like you're going to the doctor and have to make decisions today. Unfortunately, too many men have heard horror stories coming from, especially probably friends of theirs who maybe caught their cancers really late stage and had to have radical surgery. So you get the possible side effects of incontinence, impotence. Men are fearful of that they're not going to be able to be a good sexual partner, or they might fear incontinence, or that they're going to have urination issues for the rest of their life. And that just isn't the way it is. I mean, there are some men that have those difficulties, especially maybe of late age and have a late stage cancer detection. But the men I've talked to, and I've met hundreds of men with prostate cancer now through my own work, really, go through life with a high quality of life and a high quality of functioning. So we really want for men to we want to demythify that, because that's just another fear factor for men, that they don't want to, what I don't know won't kill me kind of thing, and actually what you don't know may kill you. We really want men to be more proactive about their health and what we call man up, know your numbers, know your options, and if not for you, do it for the people in your life.